And then finally, I hope I'm not taking too much of your time. I just wanted to let you know the governor's budget, we were very disappointed in as a network across the state with the AAAs. There were no increases in the budget, although she has instituted the master plan on aging, a fairly huge encompassing planning process to really make the state age friendly, but yet did not make any investments in the aging network. So we are doing quite a bit of advocacy, and I'm trying to get that all done before I retire. I've met with Senator Helming and Assemblyman Gallahan so far about it. And one example I can give you is last year, as you know, we were fighting for fair pay for home care workers. The governor did put in an increase of $2 an hour last year, and there's a $1 an hour going in this year. Unfortunately, I hate to report to you that most of that money was taken up by the MLTCs in administrative costs rather than passing it on to the home care worker. However, OFAs did not receive any increase, although we contract with the same licensed home care agencies. We did not receive an increase in our budget to cover. The agencies are asking us, our contractors are asking us for more money, but we did not get it. So we are pushing hard for that, but we're still also pushing hard for fair pay for home care workers, because that did not do the trick. We were asking for 150% of the median minimum wage in a region. And so that did not actually do it and come close to making any impact. And obviously, if the MLTCs take a good part of it for administrative dollars. So we're still pushing for that, and we're pushing for handling some of our waiting lists across the state. And we have one here in Ontario County for home delivered meals. Our costs have gone up tremendously, both on the food side and the transportation side. Right now, we've got 50 on a waiting list in this community, and across the state, there's thousands waiting. So we're pushing hard for that. So I just wanted you to be aware where we're at and what our advocacy efforts are. That's it.
I used to know what MLTCs are. Could you just remind me?
The managed long-term care entities. So all the home care from Medicaid has to go through that. And they order the aid service and contract with the agencies, licensed agencies to provide the aids.
And just to follow up, Mr. Chairman, Irene, if there was adequate funding, we lived in that perfect world, would there be enough volunteers to get those meals to people?
I think so. We do have about 200 volunteers in this community. And that, honestly, that's why I supplement with the Mom's Meals contract as well, because we saw such a huge increase in need when COVID hit. And although it has eased a little, it's still up about 30% from pre-COVID times in terms of the meals that we're serving.
Okay.
So between the two avenues, the Mom's Meals and our volunteers, we could get them out.
Okay. Thank you.
Anything else?
Good. I mean, you said there's 50 people on the waiting list. Do we have a ballpark idea of how much that would be on an annualized basis cost?
I don't off the top of my head, and I haven't had, we haven't run the figures yet of what our per meal cost is. We have to look at last year's expenses and do the math, because I could go by previous years, but I know it's gone up tremendously starting last year. I mean, my ballpark would be we're probably at about $10 or $11 per meal in this community. So in each one of those people are probably getting 5 meals a week. Some people get 6 meals a week if they need a weekend meal, or 7 there. So we can just do the calculations and I can get that out.
Are there any other, besides Albany, are there any other private or public resources available to us to to get those people off this waiting list?
Not that I know of. You would have to apply for probably foundation grants. That, I mean, it's our resources here locally and the money that the federal, it's actually federal dollars that come through the state. It's Title 3C dollars. So those are the funding sources we've operated on all these years. And most OFAs, that's their funding.
Think there a way of tracking the federal money? To find out if the state is distributing it fairly? Just curious.
Probably.
Well, they have formulas of how they distribute the dollars that they have to follow, if that's what you are referring to,
Just
or
curious.
whether they're keeping.
Yeah.
I mean, I assume they have to keep some amount of money for an overhead at the state level. But I don't think we've ever felt that it's an inordinate amount to administer the
I didn't know
program.
if it's more of it was going in this area per capita, or if it was being basically where the needs are and not where the wants are.
It's where they do population formulas, so.
Thank you.
I just wish there was some way we could get those people off that waiting list.
Irene,
I think we're working on it. We're trying to see now that we're entering into a new contract year and a new funding year. We're taking a look at things in the department and see what we can manage. But I guess I'm just saying, this is a trend and it's not getting any less in terms of people that need these services. So it's down the line. I think some decisions are going to have to be made of whether additional funding can be put in locally, keep fighting the fight at the state level and the federal level.
There's in our community, we just had a meeting with the superintendent of schools recently. Not on this issue, but one of the data points that he shared with our committee was that its free and reduced percentage is not only is it trending upward, year to year, but if you take a snapshot back 5 years, it's the increases are dramatic, and that's a really good indication. That level of family socioeconomic status is a really good indication of what's happening throughout your community. So I think there's a lot. I think that the Health and Human Services Committee, I would say it's going to be on our agenda for in a lot of different ways over the next several years. Try to tackle this in some thoughtful and comprehensive way, because I think that it's really on the need side. It's just no question about it. So.
I'm looking at my calendar. I believe we have one more of our meetings.
That is correct, yes.
We send you on your way.
Yes.
Lucky you.